It's really helped. I just need to build my legs back after, I broke my leg and sprained my MCL in 18. I just couldn't do a whole lot on that leg. I needed to build it up with proprioception first, and then once I got the proprioception back, then I really started adding some lifting.
Proprioception.
Balance.
Hi guys, Dr. H here, your source of musculoskeletal care, and proprioception is a very important topic when it comes to musculoskeletal health. It's one that I talk to almost all of my patients about. But most of my patients look at me kind of the way that you saw Pat McAfee look at Aaron Rodgers during that interview, which is proprio what? And then Aaron Rodgers replies, balance, and oftentimes I reply the same way, although that's not technically true. So what is proprioception? What can go wrong with proprioception? And most importantly, if something does go wrong, how do we fix it? Let's talk about that. So what is proprioception? Let me preface this by saying that by necessity we're going to have to oversimplify a lot of things, but hopefully the main points still get across. So essentially your body has three different systems to tell your brain where your body is in three-dimensional space. The most intuitive is the visual system. Obviously, we know how important our eyes are to seeing where we're going. The other system is the vestibular system. If you've ever had the misfortune of suffering vertigo, you know just how important that system is to aligning your body's awareness to where it is in three-dimensional space. But the last system is the proprioceptive system. And again, to kind of oversimplify a little bit, imagine you have a bunch of tiny sensors in every one of your muscles and joint capsules and ligaments, your soft tissue structures. These sensors tell your brain where a joint is in space, how much bend is in the joint, how much force your muscles are producing, their length, their rate of change, all that stuff. If you can close your eyes and touch your finger to your nose, that's your proprioception sense. You're able to do that because of proprioception. Okay, so we know what proprioception is. What can go wrong with proprioception? It's a unique system. So if you think of the other two systems, the visual system and the vestibular system, they really only have two main sensors each. Your visual system has your eyes, your vestibular system has your inner ear. And so if something goes wrong with one of those systems, it makes a pretty significant impact. There isn't much redundancy. Now your proprioceptive system has thousands and thousands and not more sensors, and so there is an increased likelihood of things going wrong. But there's also a lot of redundancy in that system, and so when things do go wrong, it's not quite as noticeable. In fact, from the second that you start getting errors in the proprioceptive system to when you notice a problem can take years. So what kind of problems do we notice? Well, really it's less of a noticing a problem with your proprioception or knowing where your body is in space, and it's more things like joint pain. You see, proprioception is a two-way street. Not only are your muscles and your joint capsules telling your brain where they are, but your brain is using that information to send commands back to your muscles and make appropriate adjustments. Well, the problem is if you have inaccurate information going in, you're going to have inaccurate commands coming out. Now, I talked a lot in my video on tensegrity about how your skeletal system kind of floats or is suspended in your soft tissue system. And because of this, it's sort of at the whims of the pull from your soft tissues and muscles. If you need a refresher on what's going on there, I'll link a link up here to that tensegrity video. But again, in a nutshell, your bony skeleton is at the mercy of the pull of your muscles. So take structures that really ought to be in the midline, like your spine. If you're getting increased pull on the left versus the right, and you get this left-right asymmetry, you're going to have misalignment of these joints. So to fall back sort of on some basic science experiments to show just how important proprioception is to your skeletal alignment, they did a study in mice where they used gene manipulation to knock out components of the proprioceptive system. And all these mice, when they hit puberty, got pretty significant scoliosis. The more elements of the proprioceptive system they knocked out in the mice, the worse the scoliosis. So again, your proprioceptive system is telling your brain where things are in space, and your brain is using the information to keep things properly aligned. If it's erroneous data going in, the commands coming out are going to be inaccurate as well. All right, so when we know what can go wrong with the proprioceptive system, the next logical question is how do we run into these problems? What kind of things happen that make our proprioceptive system not work the way it should? And there's a few answers to that, but the most common that I see in my clinic are postural imbalances and injury. Injury is a pretty common one. They've done quite a bit of studies showing that even minor ankle sprains can really have a negative impact on your proprioceptive system. Foot and ankle kind of play a special role in the proprioceptive system. It's our contact point to the ground and tells your brain kind of where your body is in relation to the ground and how your joints are interacting with your contact point to the ground. If you injure the foot and the ankle and decrease proprioception in those areas, it even has a wider effect than, say, if you injure your wrist. And so what can be sometimes a little bit tricky is, obviously, it's not one of these instances where you roll your ankle and then you have immediate joint problems elsewhere because of proprioceptive issues. Really, you roll that ankle, you get some proprioceptive asymmetries, and then it's going to take years and years and years of joint misalignment before you get enough wear and tear to start noticing things like osteoarthritis. Where we get into trouble is when we get left and right asymmetry, when you have a lot more accurate proprioceptive information from the right side of your body, for example, than from the left. Again, you can think of it sort of as reins on a horse. Right? If you have left and right side of your body and you have these midline structures, which is the horse in this analogy, if you're pulling on one rein harder than the other, the horse is going to go in that direction. It's not going to go straight. You can think of your spine the same way. If you have all these muscles attaching to your spine and the proprioceptive system is telling your brain to tighten muscles on your left, more so than on your right, you're going to get misalignment, you're going to get joint damage and joint wear and tear. Once we do have these injuries to the proprioceptive system, the most important question then, of course, is how do we fix it? For all the reasons I've already mentioned of how important the proprioceptive system is to your musculoskeletal health, I do put the majority of my patients on some type of proprioceptive training. Granted, I'm just trying to get my patients back to a level of being pain-free and functional. I'm not trying to make them the NFL 2020 MVP. So when you heard Aaron Rodgers talking about his proprioceptive training, I'm sure he had all kinds of advanced techniques and all kinds of fun technology that he got to use to really bring his proprioceptive training not just to a healthy level, but to the level required of an elite athlete. For the majority of the rest of us here, really you don't need that kind of training. It can be as simple as, like Aaron Rodgers said, balance training. So what I put a lot of my patients on at first is just single leg standing. Again, it's not necessarily a matter of how good your balance is, it's more of a matter of whether it's symmetrical. And what most of my patients will find is they can be fairly rock solid on one foot, but when they try to do things standing on another foot, they get quite wobbly. And that's not good. That is a left-right asymmetry in their proprioception. And even patients that I have who may be seeing me for somewhat unrelated things, I still usually try to put them on proprioceptive training. Proprioceptive training is not just great for rehabbing, but it's also great for preventative measures. They did a study where they put a professional men's basketball team on a 6-year longitudinal study where they gave them injury prevention protocols, one of which was proprioception. And so what they found was proprioceptive training led to a dramatic decrease in low back injuries, ankle injuries, knee injuries, that kind of thing, compared to pretty much anything else. And so it's not just a matter of fixing problems that are there, but it's really a matter of preventing problems from occurring. In fact, once you get enough joint wear and tear, it's always great to repair the proprioceptive system, but we may be at a point where we're kind of a little bit too late. Ideally, we would want to work on this prior to those kind of joint degenerative changes occurring. So that's proprioception in a nutshell. I'm often fond of saying, and all the patients who come to see me often hear, I talk about how proprioception is kind of like brushing your teeth. It's to the musculoskeletal system as brushing your teeth is to your dental health. Everybody should do it at least twice a day and at least for 2.5 minutes. It's just something that's going to generally improve your musculoskeletal health. It's going to prevent injuries. It's going to help rehab injuries that have happened maybe a long time ago and keep your musculoskeletal system as healthy as you can hopefully keep it. All right, that's all I have for you today. Until next time, keep moving.